Children literally are our future. The economic power of our state rests in successful kids, kids who've been well educated. Without that, we can't compete. And the money that might come here to help our kids and families to have a better life will go somewhere else. We need to advocate for children because they don't advocate for themselves. They need strong adults, adults who are committed to them, to talk to people in power, people who make policies that will guide the lives of our kids and the future of our state. Today, the Maine Children's Alliance is a multi-issue child advocacy organization whose programs have significant impact on state policy and also on federal policy for children. That's in part because we have a board of directors that's made up of individuals who've spent their lives advocating for children. Their experience helps us to understand how best to work with Maine policymakers and people to make better policy for our kids. In addition, we're fortunate to have a group of staff people who are the best that I've seen in my 40-year career.
Infants and toddlers are the most underserved population in our state.
We were incredibly fortunate to find Judy Wright Parker to guide our early childhood effort. She's a person who's recognized by her peers as somebody who is knowledgeable, who's fair, and has a great grasp of public policy for early childhood. She's also recognized by a number of national organizations. That has helped our influence at the congressional level tremendously. And so as a result, we have a very strong advocacy program for very young kids.
Early childhood is the foundation of all the rest of your success or failure in life. And 80% of brain development occurs by the time a child is 3 years old. So it's very important. It's like you're laying the foundation of a house. You want to make sure that the foundation is solid and strong so that when you build up, it doesn't crumble. And that's really what we're talking about here with early childhood. There has been some significant evidence that comes through that children who have adverse and negative early childhood experiences as adults are significantly more likely to have chronic health issues such as diabetes, obesity, heart disease. My primary goal in work is to advocate for policies and systems improvements that most directly impact the lives of children, making sure that there's good information and good data and analysis for policymakers when they're thinking about what is best for Maine families is the role that I play here at the Maine Children's Alliance.
Each year we have the honor of releasing Kids Count. It's an incredibly important publication because it gives policymakers factual information about kids and how well they're doing.
So this is the home page that you come to, and it's basically, the whole site is a one-stop shop for city, county, state, and national information on children and families.
Claire Berkowitz does a wonderful job of putting the face of kids on that publication, and that's what we really want to do. We want lawmakers to understand that these are real kids that we're talking about, and she's been able to do that phenomenally well.
I think it's important to track consistent, reliable data over time, and that's what Kids Count is about. You need to look at trends. You need to see where kids have been and where they've come to, or where maybe they've fallen back in terms of various indicators. So tracking things like poverty over time and seeing that it's actually rising here in the state of Maine. We need to know that. We need to see what happened, why, we know there's economic reasons and, financial meltdowns, but then looking at those numbers and thinking what can be done to improve those numbers, and then being able to look 5 years ahead and still collecting that same measurement and saying, oh yeah, that worked, or oh, we need to do better. What's very telling in this graph is the achievement gap between the children who are not low income and then the kids who are socioeconomically disadvantaged. It's about 20 to 25% across the board. So this kind of information is so important in showing that, poverty, it plays a role in the success and the achievement of children. Up to 3rd grade, you need to learn to read so that you can read to learn. If you're not a strong reader by 3rd grade, the rest of your academic career is going to be very hard because you're struggling with reading while kids are learning about the world.
As an organization, we understand that there is one set of factors that we have to do something about if kids are to be successful. We have got to stop them from living in poverty. 15 years ago, Ellie Goldberg had a vision for a project with our 6 New England states that would help both the states and the federal government to make better policy for kids that would lift them out of poverty and help us all to be successful.
The New England Consortium is a collaboration of the 6 states in New England that are interested in advocating on behalf of children. It's actually 7 organizations in the 6 states. Maine, because we have most of the experience in federal policy advocacy, is coordinating those efforts. By putting all those 6 states together, we have a much more powerful agenda with the entire Congress, because we have 12 U.S. senators in New England, and we have a delegation that in general wants kids to be well off, understands the opportunity that federal policy has to actually reduce poverty and improve the well-being of kids.
One of my jobs at the Children's Alliance is to be the Ombudsman for Child Welfare Services. What I do is essentially respond to complaints from individuals and do work that's necessary to find out what's in the best interest of that child. I then use that information to make recommendations to policymakers about what might be a better approach in child welfare in general. This work begins with the work of Carla and Tanya, who are my staff here in the office. Tanya is the person that people talk to first. It's the warm voice at the other end of the line. Carla is the person who goes out and does the work of gathering the information about the child's circumstances and what makes best sense for them.
Basically, I'm the first contact that people have when they call the Ombudsman program. I get their basic information and try to get a sense of why they're calling us. And then I pass that information along to Carla. From there, we interact with the Department of Human Services and come to a determination if they actually have an issue with DHS or if they're just very frustrated.
I will call the person to get a general idea. Tanya has already received some information, but I need to call to really get a better picture about what their concerns are and how it relates to the department's policy and practice. I will write an initial intake report, and that referral will go to the department with a request for materials. And then once I receive the materials, we'll do a full review on the record. As we finish out the case review, we will go back to the department to discuss our findings. More often than not, they do agree, and they're interested in looking at kind of a collaborative effort as to how to move ahead and to follow the recommendations that we've provided. Oftentimes we'll have recommendations for the caller as well as to how they might proceed within their case.
One of the things that we set out to do with this organization was to be not one of the usual suspects. We didn't want to be just another group of social workers advocating for kids. We really wanted to bring together business leaders with community people, with families, and with youth to have a different voice. That when people look at us, they know that what we're talking about is kids. We're not talking about this provider group or that provider group. We're really talking about kids and what's in their best interest. And I think, the people that we've assembled on staff understand that very well. Policymakers have come to understand that that's what they get from us.